What causes a sinus headache? So a lot of times our clients with headaches come into the clinic and they say they get sinus headaches. And that sinus headache could be either behind the eyes or kind of through the kind of upper part of the maxilla region, kind of the upper part of your teeth in this area. And so clients will say it's a sinus headache. The question becomes, is it a sinus problem or is it a trigeminal nerve problem? If you have a sinus infection, you're getting congestion, you have an allergy issue, types of things that actually create congestion and mucus and phlegm and all kinds of that pressure up in there, sinus headache, right? Yeah, that pressure, that irritation, that inflammation in around that area gives that feeling of a headache. But a lot of times clients complain of a sinus headache, but they don't have any drainage. And so go to an ENT, make sure it's nothing crazy, right? But a lot of the times with that feeling of a sinus headache really is an irritation of your trigeminal nerve. The trigeminal nerve is a cranial nerve, meaning it comes out of the brain, so to speak, and it innervates all the sensory kind of feeling to your face and the sinuses, as well as the muscles of mastication, the things we chew with, right? These big muscles on our jaw, little guys on the inside. And so a lot of times people that get sinus headaches really have a trigeminal nerve problem. And when that trigeminal nerve problem gets irritated, it feels like sinus pressure. It feels like a sinus headache. And so if you're somebody that gets sinus headaches without actual sinus problems, drainage issues, that might be an area to look. Some of the other culprits there, or things that would go along with that, would be jaw pain, right? You get trouble with chewing or biting or opening. That's a trigeminal nerve thing. You get other types of headaches, maybe that headache behind your eye or this headache over the eyebrow. Those are common trigeminal headaches. Upper tooth problems would give you trigeminal nerve irritation. Those are probably the big ones. Jaw issues, headaches, migraine, and then those kind of different facial headaches. So to get rid of that sinus headache, you really need to figure out what's irritating it. If it's a sinus pressure problem, well, let's deal with the sinus thing, right? Is it an allergen? Is it a whatever? You got a sinus infection, obviously need to fix that. But if that's not the case, we got to figure out what's putting pressure or irritability on that trigeminal nerve distribution so that we can get rid of that nerve irritability, which will ultimately get rid of that sinus headache.